2 days in Vegas to do this live, so I'm pretty excited.
Yeah, and welcome everybody. We did enable the chat, so feel free. It looks like Emily's here. Thanks for joining us, Emily. Once again, Keith, thanks for taking a few minutes out of your schedule. I know I wanted to dive deep on first the medical treatment of hearing loss, and like I said, we have 40 minutes together today. So maybe just like an appetizer course for everybody about what's coming up in Las Vegas at Audiology Ascending in October. So if you want to scan that code. Keith, the first and number one thing, we've been talking about this now for 14 years. We've been talking about this as I've grown with your advice and guidance and medical background into the hearing and brain centers from $438,000 in revenue to, I don't even know now. It's over 1 point something million a month, $100,000 days like yesterday. And really, that's me talking money. And I know for you, it's about the number of people helped, but maybe just give us an idea of your passion for science and this concept of the medical treatment of hearing loss.
Well, I think it's just, look, you've seen me evolve. I've gotten better talking about money because that is what it takes to treat more patients, right? And even when we've had discussions about pricing, it's always boiled down to how can we help more patients? So for me, I'm completely comfortable with it now. I'm comfortable with even the concept of selling, right? Because I've had to look back and internalize, what does selling mean to me? Heck, I had to sell myself to my wife so that she would, date me and then marry me. So it's one of those things that we do throughout life. But when it comes to the medical treatment of hearing loss, this is about helping patients to not only live their best life, but this is about improving social, emotional, physical, financial, cognitive health for our adults. See, so many people, they box hearing loss and treatment into a tiny little widget, this little rechargeable device that we have to focus on and bandwidth and channels and trial periods. No, the medical treatment goes so far beyond that.
I absolutely love that. And like I said, I mean, the partnership we've had now for 14 years and showing, I think you can see your books, your three most recent books on the screen here, and then how that parlays into treating more patients, making more money, protecting and propelling private practice moving forward. And so I start, in our coaching group at Aud Experts here, we coach about the private practice plateaus and how we went from that small mom and pop practice, how we've grown through it, and how we're on our way to that foundational company. And so we've been able to help now 68 practice owners, 205 locations around the world. We have South Africa, Australia, Europe, and a lot of those people coming to Audiology Ascending in October this year. So I'm excited to bring that community and see how far you've taken this movement from the medical approach versus the widget approach. And what I wanted to do today was share with everybody like the underlying theme being going from subjective selling, where it's willy-nilly, where we're breaking, best practices, we're breaking code of ethics, we're breaking all this stuff just to be subjective in our approach to being about medical outcomes. And so, when we talk about these things here, kind of without giving away the 5 medical outcomes, why is this important to you?
Well, look, even my own evolution, right? When I think back, I've been in hearing healthcare for 25 years, and I remember being in school, and the focus was on, we got to do a bunch of tests, we got to push a bunch of buttons, and then we have to fit a hearing aid. And we're meant to be, trained how to finely tune a hearing aid. And you know what? What's been revolutionary for me, and I know it upsets people. And if this upsets you and you're not aligned, it's okay. Hop off the webinar. But frankly, I don't give a damn how the hearing aid sounds, right? I know that sounds strange. Frankly, it doesn't matter to me if you think it sounds great, if you think it sounds okay. Now, of course, let me back off a little bit. Of course, patient satisfaction is important. I want them to hear their very best. But for me, that is not a decision maker. Maybe that's a better way to say it, that you choosing whether or not you like the sound of the hearing aid is not a determining factor of whether or not you need medical treatment for your hearing loss. And so oftentimes this concept of subjective selling is based on, how does it sound? Oh, I can fix your own voice. Oh, I can get rid of some of that trill. Hey, maybe I'll go to another widget. Maybe I'll try this. How does my voice sound? I'll talk like this. Let's have your wife go down the hall and yell your name. This stuff is craziness because this is not what medical treatment is. These are all subjective selling techniques that, frankly, I think if you go back to the annals of hearing loss, you're going to find out that it was the manufacturer that pushed some of these ideas, which is fine because they want to sell widgets. For me, it's about medical treatment and it's about outcomes. It's about understanding the necessity of treatment. And here's just, and then I'll stop. Here's my most obvious example, right? When you ask people who have glasses, why do you have glasses? They look at you like you're crazy. And it's just because I can't see. I need to do this. This is important to me. I need to be able to drive. I need to be able to do this. I need to be able to keep my job. All these reasons why they wear their glasses. Yet we don't have that level of acceptance in terms of medically treating hearing loss. It's so bad that we're treating less than 10% of people in the United States who have hearing loss.
I absolutely love that. And so people always ask me, Jared, how did you grow the hearing and brain centers? How have you done it? How have you added regions and locations? And like I said, I'm super excited. I get, a couple hours of stage time in Las Vegas for Audiology Ascending. We're going to talk all about the private practice plateaus, what it takes to move through each one of those plateaus. The short answer I can give you today on the webinar is what I do different, what I've learned by working with Dr. Darrow and taking his medical treatment approach and putting it into private practice is to be different and not just be better, right? We're not better at the little crumpled paper, dog and pony show to sell a hearing aid. We're not better at turkey mailers to sell a hearing aid. We're not better at third party. We're not better. We are fundamentally different in our approach. And that is what has helped us grow through these private practice plateaus. And so Keith, I wanted to share with everybody because for me, we can't solve anything on a 40-minute webinar, but we can meet you. We can give you an appetizer taste. We can get you to Las Vegas. We can meet you in person, have you in our mastermind room, have you at our events. We have a great speaker lineup. I know you've worked with Dr. Beck a lot. We have a couple great practice owners sharing how we help them grow from a smaller practice to a practice that is protected from inflation, that is protected from third parties, that is protected from insurance companies and all the pressures we face as owners, audiologists, hearing instrument specialists. Anything you want to say about the speaker lineup and what you plan to present as you're always, the main show?
Look, we've done a lot of live events over the last few years, and some of them we planned so hastily that next thing you know, it's like I'm on stage for 16 hours because we didn't even have time to ask other people to come and join us. So for me, it's so exciting when I see this lineup because this is so well-rounded, right? This almost, when I look at this, and I'm just looking at the screen here, I think about how we have to take a holistic approach to treating our patients. Well, this is a holistic approach to growing your practice, right? Everything on this screen, these people represent everything from science. You have myself, you have Dr. Edwards. There's going to be marketing, right? And not just marketing, certainly not turkey mailers. I'm talking about marketing the medical treatment of hearing loss, which obviously will be you, our marketing ninja. We have Kim Garrett, practice owner, who's built some amazing marketing systems. We have Frank Vinipal, who's going to talk to us about accounting and what it's like to run a practice and how to sort of manage your money better. Reese Jones, Dr. Terry Edwards, our lead trainers that are out there, boots on the ground, working with hearing healthcare providers, not just across the country, but actually across the globe. So it's really going to be an exciting event. We got Dr. Nashley Brogan. It's one of these things where I look at this and I see, this is what it takes to run a practice, right? Our pillars have always been marketing, science, mindset, and culture. And we're going to dive a mile deep on each one of those pillars so that you can grow your successful practice.
Yeah, I love the Kim Garrett story and the Ashley Brogan story. That's why I invited them to speak, because Kim and Lane came to the group as former Audiology members, Fuel Medical buying group members. They came to prove us wrong, right? Their local manufacturer rep referred them and said, these are the people you want to listen to. And they joined to prove us wrong. And here we are a few years later, they're adding locations, they're adding staff members, they're on vacation right now. And so, when we talk about running a private practice through these plateaus and having accounting advice and generational wealth advice and legacy planning advice, this truly is the event for your personal freedom and your professional practice growth. So super excited. I know that some people can't make it. Ryan Hill's with us today. A few others have already told me they can't make October. So I just wanted to share all three of your upcoming events. Keith, maybe you can touch on dementia certification. I know you just got off with South Africa this morning, but maybe talk about these three events really quick while everybody has a chance to scan and register.
Look, it's really important. We can't just offer one event a year and say you either come or you don't, right? You've got to offer a couple of options for people, and it really just depends on what you and your team need. So, yes, the dementia certification. I can't tell you how excited I am. This upcoming certified dementia practitioner course, which is CEU approved, which is actually governed by the National Council of Certified Dementia Practitioners. We are going to certify our 1,000th person at this upcoming webinar. After South Africa's numbers this morning, I realized we are going to hit our number 1,000. This is all about the role of the hearing healthcare provider in cognitive care, in dementia care, be it dementia diagnosis, prevention, care for a person with dementia. There's so much to it, how hearing loss affects the brain, increases the risk. I mean, it's hard to summarize in under a minute, but it's one of those things where it's probably one of the most popular courses that we have offered, and we receive rave reviews over it.
Keith,
Audiology Ascending, right?
Keith, on that one real quick, I need to take everybody back because I remember the first few years. I remember the hatred, the vitriol. I remember the black sheep moments. And here we are, 1,000 hearing healthcare practitioners who are now certified. I now see manufacturers talking about dementia in the brain. I remember when you got the cease and desist, maybe I got the cease and desist letters about not being able to.
I send those to you.
But like, just where does your mind go around the movement that you've been a part of, or you've created, whatever word you want to use? I know that you don't really look at it that way as much as I do, but like, where does your mind go about the progress?
So I would back you up even a little bit before that. When I first took the course, this certified dementia practitioner course, I took the course, I became a trainer, I invested all that time and money because that's what I wanted to do to be the change in audiology. And then I had the idea, hey, wait a second, why don't I bring this to audiology? And I remember filing a CEU application with two of the major organizations, I won't call them out, and they responded back to me with, why would we approve this course? This doesn't make sense. I don't see anything about a widget. I don't see anything about a bandwidth. I don't see anything about patient care. This doesn't make sense in hearing healthcare. And I was just like, wow, what is it going to take? Now, we went back and forth a few times and then it did get approved. But yeah, I mean, so many people have been, oh, this is a fake course. Oh, I made it up in my basement. I mean, I don't care, right? At the end of the day, it's a course that's actually recognized and recommended by the Centers for Medicare Services, by the United States government approves the course. Like, it's a pretty cool thing to sort of take your audiology hat off for a few hours and learn about cognitive health, learn about preventing cognitive decline so that you can take it back to your patients. And I know it's been monumental because, right, you want to work with us, you've got to be a certified dementia practitioner, and it's helped to transform the type and the level of care that we provide our patients.
I love that. So we already talked a little bit about October. That's really for your private practice owners, people looking to start a private practice, how to add personal freedom and practice growth at the same time, right? Like how to protect and propel the future of private practice. That really is the best practices of business, the best practices of marketing, everything, you can have there in a community that's done what you're trying to do. There's some great masterminds, some great people in that room. I see a couple of them, Cliff Carey and others on this call that have been there, have been in the trenches and have done it. I really want to hit home on the tinnitus certification, Keith, because last year we were at Harvard. We did the huge tinnitus and cognitive processing disorders. This fall, we're doing one. It is available virtually. So if you sign up today, you can attend virtually or in person. But tell me about the tinnitus certification. Tell me about your relationship with the Tinnitus Association. Tell me a little bit about tinnitus right now.
Yeah, well, look, I think for me, once we built all the content and all the marketing and all the tools and trained our staff on really how to handle people with hearing loss, I finally felt ready to say, all right, guys, now that you feel comfortable, I'm going to make you feel uncomfortable. And I'm going to introduce you to the concept that tinnitus and hearing loss are actually one and the same, that they are the same thing, that they are just symptoms of the same neurologic disorder. And once again, got a lot of kickback on that because, right, there are lots of organizations that sort of think of them in two different ways. And we have patients that say, I have tinnitus, but my hearing is fine. So over the years, you and I have realized, from my perspective, there's 70 plus million patients to help that are living with tinnitus. From your perspective, that's untapped potential, right? For business growth. And so we came together, created the books, created the contents, the videos, and we have trained our teams on how to provide best practices when it comes to the medical treatment of tinnitus. That's what this event is all about. Of course, we're going to talk about hearing loss, but I am going to dive deep. I think I got about 4 hours on the first day diving deep into what is tinnitus? Why do people experience tinnitus? What is the proven 7-step process for effectively treating tinnitus in 90% of your patients? And then we're going to have some fun, right? Because then we're going to have Dr. Lane Garrett speak to us about TRT. We're going to have Dr. Patty Kallenbach teach us about linear and neuromodulation. We're going to have Kevin Weston, world-renowned exercise physiologist, talk to us about exercise and nutrition and how it affects tinnitus. I mean, this is a well-rounded, holistic approach. But wait, there's more. On day 2, it's going to be a hands-on lab, a actual, like, we're going to play patients, we're going to do role play where you actually walk through our proven system to help more patients with tinnitus. So whatever it costs you, if you do it virtually, if you come out, you're going to make that money back on Monday. And then again on Tuesday, Wednesday, Thursday, Friday, so on and so forth. It is such an incredible investment for you and your team. That is a guaranteed no-brainer.
Absolutely perfect transition. Anybody has chats, feel free to chat in. But for me, this is an absolutely perfect transition to the point of subjective selling to objective outcomes. Everything we've done, and I have here, I don't know, I hope everybody can see it, but this is your, I was just looking for the date. I think it's about 10 years old now, but it was the original Dr. Darrow 12 treatment phrases when you came to my practice that had hearing instrument specialists, audiologists, fake hearing instrument specialists, salespeople, turkeys. I mean, I had everything in my practice. And here we are now years later. And like, I want to go back to like on the topic of tinnitus specifically, the number one thing I hear when I watch video of my practitioners, my audiologists, my doctors in the room is, so how's your tinnitus now? Does your tinnitus sound better? And that is like just the example of all examples of subjective outcome. How does it sound versus the objective medical outcome? And now I'll let you riff and tell us what the actual medical outcomes are. And then we can talk about some examples and case studies of how our training manuals, and I have another training manual here, how you and Reese and Dr. Edwards have held regional trainings, on-site trainings, and how we transitioned over the last number of years from this subjective approach to this medical approach. But how about that one specifically?
Well, I think, you hit the nail on the head there, that as soon as a patient comes back 7 days after starting treatment for their tinnitus and says, I don't notice much of a difference, you can literally see, because we watch game film, you can see the audiologist, the HS, you can see the melt, you can see the fear take over them of, oh crap, now what do I do? That is literally the definition of subjective selling. You are relying on the patient saying, I like this. It sounds better. My tinnitus is less, which is totally different than, well, I appreciate you telling me that that's your experience. As we discussed on day 1, treating tinnitus can take as long as 6 to 18 months. And I'm just really excited that you've already taken your first step. And, just to forewarn you, what you may notice in the first 30 to 60 days is you may see a little bit of a roller coaster. It may go down some days and up some days. That is your brain adapting to the new stimulation and attempting to turn down those neural feedback loops that created tinnitus, right? This is objective. This is, I'm sorry, you don't have a choice. You must treat your tinnitus, because here's one thing I can promise you. While I can't promise you your tinnitus is going to go away, I can promise you if you don't treat, it will get worse, because it is a progressive degenerative disorder. And so
And
you must take
yeah,
action.
I would love to have, I know we have some new faces. People are going to watch this recording. I would love to see you chat and say what you disagree with, because I know every time I have a new audiologist start, every time I have a new hearing instrument specialist start, every time you've spoken at IHS and AAA, like you run into these questions, Keith, of the objective outcomes. This profession, our industry, private practice, non-private practice, like this isn't what we were taught. So it was very enlightening to me to hear the science, but maybe just give everybody first and foremost what the 5 outcomes are. If you write these down and you start learning these, studying these, researching these, you can go to Google, you can go to PubMed, you can go anywhere you want to find the information if you care enough about the 5 medical benefits. You can also go to training.audexperts.com. All of it is saved with videos from Keith. All of it is saved with the research reports, with the peer-reviewed journals. We've provided all of that for my team, especially, and for our community. So it does exist, Keith. But what are those 5? And let's start there.
All right. So I always start with the easy one. And I tell my patients, look, here's the easy one. It's going to take me about 30 to 60 days to get you from hearing good to hearing great again. And the instant thing you're going to notice is an improvement in quality of life, relationships at home, self-esteem, right? That's like that instant boost. But what I also want you to know is kind of behind the scenes in that brain of yours, what we're doing by treating your hearing loss today, obviously increasing quality of life. We are going to improve cognitive performance. We know that in under 14 days, we can increase memory recall, selective attention, processing speed. And by the way, these increases are maintained for at least a year. And I say at least a year because that's the only data point we have is out about 12 months, where there's significant improvements in memory, significant improvements in ability to make decisions and processing speed, right? Which is really important to older adults who are trying to actively age. We know that treating hearing loss can significantly reduce the risk of a traumatic fall, which in turn keeps you out of the hospital, keeps you in your home longer, and it keeps your kids from forcing you to live in their basement, right? So that's a really important aspect of treating hearing loss too, that most patients don't know. Now, if you are living with tinnitus, we know that treating your hearing loss properly in about 90% of patients will effectively reduce your experience of tinnitus. Finally, right, I don't leave this till the end because it's not as important, but we now know for 7 years running that treating hearing loss is the #1 thing you can do to reduce your risk of cognitive decline and dementia. So these are the benefits. And so kind of like a doctor saying, look, I don't care if you don't like the taste of the medication. Look, you might take this medication and you might get sick to your stomach for a few days, but you have to muster through it. This is critically important that you accept this prescription that I'm giving you, right? So that is what objective selling is. That is what objective outcomes are. And by the way, those 5 benefits, you have to measure them. You can't just ask people, so how's your tinnitus? So how are you hearing? You have to objectively be able to do pre and post measurements so that your patients actually understand the value that you are providing to them.
And I know, Keith, we're gonna dive into that in person at audiologyascending.com this October. Some of it, as far as a tinnitus perception, will be covered in November. So scan those codes and attend with us. You're gonna dive a mile deep. You have a workbook. We're gonna walk you through those. Is it fair to say, and I listened to, thousands of hours of incoming phone calls from patients, thousands of hours of footage of my treatment rooms. Is it fair to say that patients are showing up in your mind, Keith, for #1, which is quality of life? They want to hear better in background noise. They want to reduce their tinnitus, all subjective benefits. They want to hear their wife or hear the TV. I mean, is that a fair statement that what they're generally coming in with a subjective desire is to improve their day-to-day life?
Well, look, we're in the minority here, but the majority of marketing in hearing healthcare has a picture of a widget and an old person smiling, right? And so the message has been conveyed for 50 plus years that if you get a hearing aid, you will be happier. It will improve your quality of life. In the spring, you'll hear the birds. In the winter, you'll hear Santa's bells. Like all these crazy little buy a hearing aid and you'll be happier. What we've done is said, okay, well, historically, that has enabled us to help 9.6% of people with hearing loss. What about the 90.4% of people who are living with hearing loss and who are not treating it? Who are, many of them are actively sitting on the sideline saying, I already smile. I don't need to smile more. I have a great quality of life. And they're sort of subconsciously saying, well, I didn't even know hearing loss had anything to do with dementia. I didn't know hearing loss had anything to do with my tinnitus. I didn't know hearing loss had anything to do with my risk of falls, right?
And I think the point I would hit home with the subjectiveness, right? Which, look, I'm not disagreeing. Every single patient calls and says those things. They're not calling saying, I want to reduce my risk of falls. In fact, I don't think I've ever had a patient call and the first words out of their mouth are, I want to come to you so that I don't fall, right? The first and most impactful thing is that subjective. But now you as the medical professional, you as the trusted authority have to connect that back to the actual objective outcomes of treatment. And that is what helped us grow. That is what helped us protect and propel hearing and brain centers. It's what's done it for our clients in Aud Experts community. It's what the purpose of our Excellence in Audiology Worldwide Network are. And Keith, like I know you have all the science for each of these stats. And like I said, we're limited on time. But when you move on to that second objective outcome, right? So a patient comes in and wants to hear better in background noise. You started alluding to it. How do you talk about the cognitive function improvement? How do you talk about the reduced risk of dementia? How do you bring that up as a scientist that's read the reports, that studied the reports? What's the most important part for you to transition from the subjective to the objective, and then give them something tangible, a piece of paper, an outcome sheet? How do you do that?
Well, look, yes, let's just round up and say 100% of patients will comment that they don't hear that well in background noise. Some say it's terrible. Some say, yeah, it's just not as good as it used to be, but it's not a big deal. Either way, they mention that they have difficulty hearing a noise, even if they came in for tinnitus or something else, right? As soon as they say that, that is my cue. It's my job. I think it's all of our jobs to educate our patients. Stop right there and then and say, well, I appreciate you telling me that. Were you aware that difficulty hearing in background noise, when it's hard to follow a conversation because there's all that noise, that's actually a major risk factor for developing dementia. Some of the research has even said those who have difficulty hearing in background noise are 60% more likely to develop dementia in the next 10 years. So I'm really glad that you came in now. So I'm going to help you hear better in noise, but I want you to know the added benefit is we're actually going to further reduce your risk of cognitive decline and dementia. See, those are objective outcomes. Those are value propositions that a patient can't say, oh no, I don't want that. Right? I mean, that's just crazy. No patient would ever say that. So it has to be these objective, scientifically evidence-based data that tell us these are the benefits of treating hearing loss, not just hearing the birds and hearing your grandkids.
And I think the thing I want to share, Keith, is what it's done for my practice, right? What it's done for my providers, my audiologists, my hearing instrument specialists, even my phones team. What it's done is it's allowed us to reach more than the 9.6 that everybody else is fighting over, right? So 9.6% of people are responding to these subjective things. They want to smile more, they're grumpy. Well, what I found was that 9.6% of people is actually the oldest group of people. That 9.6% of people are the ones that have finally struggled for 8.6 years. They finally, their family's their wife's going to divorce them, their husband's going to divorce them, their kids are forcing them to do it. They're already in a nursing home, right? I don't want to fight over that small percentage of people. I want to go to a blue ocean. If you read the book on blue ocean strategy, I want to go to people while they're younger. And I think this is where we transition, Keith, into your movement of preventing decline. It's something you've been talking about for years. If you go to preventingdecline.com, you can see the direction we're going. If you go to the App Store and download the Preventing Decline app, preventing decline is the new umbrella term that you're moving forward with and helping. Just like we did this last March, we had the Dr. Cliff, we had a nutritionist, we had an exercise person at Preventing Decline. But tell me, like, Keith, when you start expanding and elevating the scope of audiology, how we'll reach more than the 9.6% of people.
Exactly. Look, we have two choices. You can stay status quo. You can talk about hearing loss and hearing aids. You can talk about trial periods. You can talk about 100-day test drives. You can talk about all these, buy a hearing aid, smile more. 9.6%. Dare I say, if I got a 9.6% on a test, that would be a failing grade, right? And I've had some students do that. But anyway, like that is not performing well. And so we have to do something different. And for me, honestly, and this, it's never been about, well, what marketing trick can we use to get more people? For me, it's we have to increase the health literacy of the general public. We have to make sure everybody knows that hearing healthcare is preventative medicine, right? And there are so many people nowadays that actually care. So our healthcare system has transformed. It's not perfect, but it's transformed over the last 10 to 20 years from completely reactionary to now there's a big group of the contingent that are actually trying to be preventative. More people go for their annual physicals with their doctors than ever. More people are actively aging. They're playing pickleball, they're skiing. The older generation wants to actually add life to their final years, be it 5, 10, or 20. And so treating hearing loss is one of those things we know can maintain positive social, emotional, physical, financial, and cognitive health. And so, yeah, that's really been our message, because that is what hearing healthcare is all about. It ain't about the widget. It's about ensuring patients live their best life. Sorry.
Yeah, and I just the boots on the ground is it's given my staff the authority to be the doctor, provider, specialist that they are. And it's allowed me, the marketer, to reach out to a growing list of patients, right? We've now brought the average age of our patients down by over a decade since I met you, Keith. 10 years younger, 10 years sooner. And I know you have a statistic on dementia there, about 10 years, but 10 years younger. That means I'm reaching them when they're able to use their Bluetooth, when they're able to connect to streaming devices, when they're able to avoid a senior home or assisted living, when they're able to, and I'm going to say it, they're able to upgrade every 4 years for 1, 2, 3, or maybe even 4 cycles. So now my lifetime value of a patient, the profitability of my practice, which you don't have to say it, Keith, I'll say it. I'm here to protect and propel private practice, and I am here to reach more people. I am here to use science to communicate and to help their health literacy to help my practice. That's why I'm here. I'm here to help my team as well. And so it's allowed us to reach people that nobody else is talking to. And so everybody else is out playing with the silent generation and the people that don't know how to use Bluetooth and don't know how to connect and change a battery, and they're worried about rechargeable. And I'm sitting here talking about science and active aging and living longer and playing more pickleball and not falling and breaking a hip. And look, there is now another 50 million baby boomers in the next 10 years that are coming into the sweet spot. The problem is most private practices haven't been talking to them. Most private practices don't understand their pockets of patients and pockets of profitability. And most private practices haven't been nurturing them like you and I have with your books and your webinars and your symposiums for the last 10 years. So I'm just waiting for this group of people to come in, because we already have a relationship with them. It's not going to be the first touch point in their health literacy or their health journey.
Yeah, I think it's look, here's a pretty amazing statistic, right? I don't know if it's completely accurate, but I'm betting it's pretty close. The estimate is that 80% of people with hearing loss fall into the mild category. Now, I'm not going to go on a tangent about mild, but at least the way the field thinks of it, 80% of people have a mild hearing loss. And that 80% doesn't really think they have a problem. So what we're like that 10% is really moderate, severe, profound. That is where most people treat their hearing loss. And you just nailed it, right? When do you get to moderate, severe? You get there in your mid to late 70s. That 80% of people living with hearing loss in the mild category, they are in their early 60s, dare I say late 50s, because we know that the neural degeneration of the auditory system starts in the third decade of life, in your 30s. People start to become symptomatic in their 50s, and they wait anywhere from 10 to 20 years to finally say, okay, I need help. And at that point, we all agree it's much harder to treat. There's less patient satisfaction, et cetera, et cetera. So why not turn your attention to the people who don't think their hearing loss is a big deal and educate them on how it is a big freaking deal, and that if we treat your hearing loss, we can help to prevent decline.
I absolutely love that. And you have some great webinars on training.audexperts.com if you want to see things about, normal hearing loss, but auditory system damage. And I think, Keith, what that's really allowed, once again, boots on the ground, is I'm not fighting with my competitors over the 9.6% of patients. I'm not worried about the effectiveness of the newspaper ad, because truly, and it just came to me, I'm going to change the vision of hearing and brain centers to be focused on treating mild hearing loss, right? Stage 1 hearing loss. I don't even want the people in stage 4 and 5, just like I don't want the cochlear implants. I don't want the pediatrics. I want the 30 to 50-year-olds with stage 1 hearing loss, because that is the blue ocean. That is where we can communicate. That is the group that understands the trusted authority. That is the group that loves the book, loves the video, and nobody else is telling them that they have a major problem that can be addressed and mitigated early on in life. They're waiting too long to help these people. And I know you talk about it all the time, but like, imagine letting diabetes go unchecked for 20 years. Imagine letting heart disease go unchecked for 20 years, or cancer go unchecked for 20 years. And like, we have to change the paradigm. We have to change how we communicate. When everybody comes to one of these upcoming events, Keith, I think it needs to be October, Audiology Ascending. I think they're going to get so much time with you on stage, but then also get the business aspect of how do you deploy it through Reese Jones? How do you deploy it through Terry Edwards? How do you deploy it through Morgan and cultural shifts? I think you have to be there in October. If it's only tinnitus, you don't care about anything but tinnitus, of course, we'd love to see you in November. You should be in November anyway. But Keith, what are they going to get when they come and they hear you on stage in October, when you dive a mile deep on everything from the concept of the medical treatment of hearing loss and tinnitus to best practices to how to actually do it in the clinic?
Well, I think they're going to get what just happened with you and I. So for those who are watching, you just saw live a real moment of Keith's science and Jared's brain just realized, hey, wait a second. We need to completely change the way we do things, right? And half the times, I don't even know when I drop something on Jared that he's going to respond that way. Sometimes I save it and I drop it on him when I feel like it's the right time. But that's a perfect example of, you are going to learn these nuggets that are going to change the way you think about hearing healthcare, which means it's going to change the culture within your practice. It's going to change the way you market. It's going to change the way you look at the science and training of your providers. It's going to look at everything that you do in your practice that makes you successful. And dare I say, it's going to 10x it. Because when you come to a live event, especially this Audiology Ascending, our little growth con, whatever you want to call it, wherein you are going to take away a message that forever changes the way you operate. Right? And how does our field operate? We operate at about $400,000 to $600,000 per provider. This is going to teach you the steps, the pillars you need to build a successful foundation of a practice, so that your providers are constantly spitting out 1 to 1.4 million in revenue, which that's just revenue. To me, that's just double the amount of lives affected.
I love that. And for those that do come, we're gonna help you write your book. right? We're going to help you put into place pre-education. We're going to help you train your team. We have group community calls, online training. Keith, I'm holding up right now your Audiologist and Provider Practice Summit. I know you just got off the phone with a practice this week. I know you're going up to Canada with another one of our clients. But what has it meant to you to actually help the providers make change and coach them as a teacher, as a university professor? Like, what is the thing that's really helped you see the light bulb moment for practice audiologists and practice hearing specialists?
Look, for me, it's always about breaking down those limiting beliefs. It's about breaking down, well, I wasn't taught that in school, or no, I don't know. It's all these things of, well, here's an example. I don't know, there's no research that says premium's better, right? There's just one tiny little example. And then we dive a mile deep on that topic. And we talk about ease of communication. We talk about reducing stress, reducing cognitive overload, and how important that is for our patients, right? And how patients acknowledge that new technology, premium technology, can help reduce that fatigue factor. Well, guess what? That fatigue factor is what's increasing their risk of cognitive decline and dementia. And so it's really important to always prescribe XYZ. So this is that's a tiny little sampling of what I enjoy the most, is going out there and helping people to realize, hey, wait a second, I've got these limiting beliefs that are holding me back. And if I'm held back, then my patients are held back.
Yeah, just another nugget on the subjective versus medical outcomes. I know that there's new science out there about how an undertreated hearing loss is just as bad as an untreated hearing loss. And you're going to dive into that, I know, at both of the upcoming events, and share with them what that actually means for, tell me if I get this wrong, a cortical reorganization and the way the brain works. But at the end of the day, you just said something about a widget. And I think a lot of people, we have to meet people where they're at in their practice. And they maybe have 5 different brands, 5 different tests, low-end technology, high-end technology. So the boots on the ground thing we've seen with new audiologists, new specialists in our practice is somebody that says, like, I'm going to sell, I sold that patient a hearing aid. I started treatment on that patient, but it wasn't with premium. And you mentioned premium, Keith. And the thing I love about your concept of premium is, what you said is you're actually wanting to prescribe the thing that does the best at speed signal to noise ratio, right? Because that's what's causing the fatigue. So maybe tell us how, like, the patient says, well, I want a cheaper hearing aid, and everybody jumps at joy that they said, yes, I want a hearing aid. I just want a cheap hearing aid. And then how you transition that to the medical objective outcome.
Right. But you need to have the right mindset. You have to understand the science, because then you just turn to your patient and you say, well, no, that's not an option, because I'm not willing to compromise your care. Because what we know from Dr. Hannah Glick is that improperly treating hearing loss, meaning no real ear verification, low-end technology, could be just as bad as no treatment at all. And these are studies that were, this isn't personal opinion, right? That's the problem, is all the studies out there that say premium's just as good as low end. That is literally the definition of subjective opinions, right? That's what they base it off of, compared to real science that shows the brain is not able to properly reorganize itself to properly accept the stimulation of sound with low-end technology and improperly fit technology. So there's just one example, again, of the science is what drives the decisions we make. Can I make a hearing aid last 12 years with Band-Aids and super glue? Of course I can. Am I under treating my patient for 8 years and increasing their risk of cognitive decline, their risk of falls, their risk of experiencing more tinnitus? Yes, I am, and I will not allow that.
And I know, Keith, you know, your words on subjectiveness and tinkering with programming and all of the things that aren't best practices, you know, you relate that to other medical conditions and how it would be malpractice if somebody just decided they were going to go off a process or go off a best practice. And so I just challenge everybody between now and October, when we see you, to think about that. What if your doctors went off script? What if they started saying they were smarter than the pharmaceutical formula? What if they started saying, look, their best practices are different and better? Like, there has to be some some guidelines and some templates in hearing healthcare. But Keith, I
Well,
want
that,
to go back. I want to go
yeah,
back
but that's a
to,
great example, right? Just to sort of quickly elaborate, a diabetes doctor is not allowed to prescribe medicine from the 80s because he remembers back in the 80s it worked really well for some of his patients, right? Like that's subjectiveness as compared to objective data that actually says that's illegal to do, unethical, and you'll lose your license. But we sell, oh my God, we sell used hearing aids. We sell low end hearing aids. We sell all sorts of crazy stuff, but nobody holds us accountable.
yeah. And
Sorry, what were you saying?
no, I just want to give the example because I hear it every single day when a patient says, well, I know there's another level. I know there's something cheaper. And most people will just take the sale. They won't engage in the objective outcome. They won't say the sentence, my fear is, and I'm going back to your treatment phrases binder that I have sitting here, right? Because we're going to give everybody your treatment phrases and your weakening phrases, because the weakening phrases happen just as much as the power phrases. But when that patient says there has to be another brand, there has to be another level, there has to be another price point, like I almost want Keith to role play it right now. I know this is where you and Keith specialize in your one-on-one trainings, but I need the objective overcoming that through science and through outcomes.
Sure. Well, my fear is that we will significantly compromise on your treatment, right? And so, what I know from the data that's out there is your biggest complaints and the most significant findings through your evaluation are that you need assistance with clarity and in background noise. And these are what are taxing your brain into so much fatigue. And so, with the technology that I am recommending and prescribing for you, I'm not worried about. It's that other technology that, yeah, there's lots of levels, lots of brands. There's more flavors to hearing aids than there are flavors at Baskin Robbins, right? But what we do here, the widget, the hearing aid is only part of the entire process. And so, are there cheaper options out there? Yes, but we're not willing to compromise on your care.
Yeah, and I
And
think
on the treatment
if you
outcomes.
take that one thing, right? We gave you, I heard 5 examples today. I know we're running short on time, but if you take that one power phrase and you spend the next 60 days until we see each other together in Vegas, you will help more patients properly stimulate their brain. You will help more patients say yes to treatment. You will help your practice grow just on that one thing. Keith, we are out of time, and truly, I know we're gonna have a couple more pop-up webinars between now and October, but look, you got to be there in October. It's going to be the best thing for your providers, the best thing for your practice, the best thing for your personal growth and freedom. I can guarantee it. If it doesn't work out for you, I'll give you your money back. I think it's like $300 to register. You got to be there. But on tinnitus, Keith, I know you're also launching a big study, which is one of our #1 patient health literacy education campaigns. We do it every year. Like, if these people sign up and come to the tinnitus certification, can you just give me some excitement around, some theory around, and what you and the students at Worcester State and what our practices in the community are trying to do with this study?
Yeah, so every year or so, we launch a multi-site study across basically North America because we've had Canada involved. We've had, I think, at least 40 out of 50 states involved in our studies. And this one is going to be specifically on the medical treatment of tinnitus. There will be different groups of patients. We are going to study sleep patterns, stress patterns. We are going to look at some of the differences between, right, using the primary treatment and adding in some supplemental treatment, be it exercise, be it melatonin, right? We're working on those fine details right now, but this is going to be an incredible, I believe, monumental study that I'm actually looking forward to getting done this year during my sabbatical and then having, written up and published by the mid 2025. And so those who come to the tinnitus certification event, your practice will be welcome to join this study because I now know that you've been through the program. You understand the concept of treating tinnitus. You understand the 7 effective steps or the 7 simple steps to effectively treating tinnitus. And so we're going to talk all about that at that event. It's a really exciting time, I think, to be in the study of tinnitus, especially with all that talk of linear and neuromodulation. It's a great time to sort of double down and say, hey, what about the #1 proven way to treat tinnitus and how can we help more patients?
Like I said, there's a lot of ways for you to increase your engagement. Like I said, you can go to training.audexperts.com. There's a lot of free webinars from Dr. Darrow, from Morgan, from Reese, from Terry, from the whole team, helping you get to know us, understand us. But really, the thing we see with private practice success is those that attend events, those that attend trainings, that come engaged, that want to improve, that want to help more people, that want to treat more of the 1.5 billion people. You increase your engagement and your results will be there. I really, truly hope to see you all in Las Vegas at Audiology Ascending. It's going to be the greatest private practice event, 100 practice owners. We're going to have everybody in the room. You're going to hear stories of who we've helped, how we've done it in our practice. And really what the mission is to protect and propel private practice. And then, of course, the medical treatment of hearing loss. Keith will go a mile deep. Keith, thanks for joining us today. Once again, there's a lot of ways to engage with us. The free site, Morgan at AUD Experts, but definitely show up to one of those events. And I promise you, you will have your best fourth quarter ever. You will have your best 2025 ever. You will eliminate the need for third parties, insurance companies, and this idea that audiology and treating hearing loss is a scarcity approach. But really, there's more people than all of us together can do. So here's to a rising audiology. Here's to a rising profession. And we look forward to seeing you there in October.
Take care, everyone. Thank you.